have a seat. I'll be with you in just a moment, okay? Alright, sorry about that. I'm just finishing up a note for a different patient. I am Dr. Morika, and welcome to the night clinic. Can I get your first and last name? Perfect. And your birthday? Okay. Alright. I have you all pulled up. It does look like you have not been with us for a while. Is that correct? Okay. Have there been any changes since the last time you were here? Any family history or personal history? Okay. 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 Alright. How about exercise? Are you getting any exercise? Okay. Not as much as before. That's okay. It's a difficult time of year. Not to worry. Just do your best to, do a little bit each week, okay? Good. Everything else, your parameters are looking just fine, so, and you said no changes to family history? Okay. Anything else? Okay. Okay. And how many times a week would you say? Okay. Yeah, that's fine. Okay. And we'll just, there. Perfect. Okay. So what brings you in to the doctor today? Just a general checkup or something else of a concern you want to bring to us? Okay. Okay. General checkup, but you did have a little fall. Okay. I see, okay. Did you lose consciousness with your fall? No, okay, that's good. But you do have a bump. Okay. Do you mind if I take a view of that? Okay, yeah, there's definitely a good bump back there. Has there been any vision changes or headaches or any sort of cognitive issues? Okay. Okay, some headaches but no vision changes. Okay. Okay, alright. So how about we just do our regular exam, and then we'll just do a couple of little extra things. But from the sounds of it, nothing too concerning. Can you just describe the actual fall for me real quick? Okay. Okay. Yeah, no, that doesn't sound, terribly concerning, which is good. So, but better safe than sorry, I always say. So, we'll just do a couple tests, and if anything comes up, we'll refer you out, okay? Good. Alright, so during the physical exam, I will be touching and getting closer to you. Is that alright? Okay. So I have your permission. That's good. So what we'll do is I'll start out, we'll get some vitals, and check your ears and your eyes. Perfect. Okay. Alright. Alright, I'm going to just listen to the heart and the lungs. I'm going to ask you to breathe deeply. Are you able to do that? Okay, no breathing problems. Perfect. Alright, very simple. Just checking your heart and lungs. Okay. Alright, just listening to the heart. Okay, good, good, good. Sounds good. And just listening to the heart. Okay, strong. No issues, no murmurs. Perfect. Good rhythm. Okay, your heart sounds good. So now I'm just going to ask you to take some deep breaths for me, and I'll have you inhale completely, and then upon exhale, try to push all of the air out of your lungs, okay? Good. Alright, deep breath in, into the nose, and exhale out the mouth. Good, 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 good. Deep breath in, into the nose, and exhale out the mouth. Good, good, good. And now the other side, okay? Deep breath in. Good, into the nose, and exhale out the mouth. Good, good. Lungs sound clear. Good. I'm just going to reach behind you and get the bag. Okay, good. Deep breath in and deep breath out. Good. Deep breath in and breathe out. Good. Good. Alright, everything sounds really good. Okay. Just going to take your blood pressure. Okay. So, the cuff that we use for blood pressures can be kind of tight at times. But it is very short-lived. Okay, good. So just sit in a nice neutral position. Don't cross your legs, and kind of just sit normally. Okay, good. And the cuff that's going around your arm. Okay. Doing all right? Okay. Okay. Those numbers sound really good, okay? Nothing concerning whatsoever. Okay. So I'm going to just sanitize my hands and then pop some gloves on, and then just going to take a quick peek around the skin, okay? Okay, and now a fresh pair of gloves. just gonna take a quick look around the skin just for any, moles or anything that might need a little extra attention, okay? So I'm gonna come close. Good, okay. Okay, everything looks good on this side, okay. Okay, there's just a mole on this side. I think that it's got a little on the larger side. I'm just gonna grab my measuring tape and just measure it, okay? How long have you had this one? Since as long as you can remember, okay? Usually the ones that we have, from a very early age are not as concerning as others. So I'm glad to hear it didn't just pop up. Okay, it's within normal. But it is a little on the larger side of normal. And it's a little irregular looking. So if you want to just keep an eye on it, and if there are any changes, just bring those to us, okay? Of course. Okay. I have my otoscope here. And then I'm just going to grab a fresh tip. And I'm going to take a quick peek into your ears, okay? Okay. Alright. Just looking into the ears, and the eardrum is good. No redness in the ear canal, and no build up. Good. Everything looks good. Alright, that side's good. Let's take a look at your other side, okay? Okay, good. This side looks good as well. No build up. Eardrum is good. No redness. And no redness through the ear canal. Very well done. Good. Very good. I don't see any concerns at all there. Just to check your hearing, I just have a little tuning fork. Just going to move it back and forth through your ears. Just going to raise your hand when you can hear it, okay? And then when it goes away. Okay, perfect. And one more time. Alright, and then when you can't hear it. Good. Okay. Everything looks really good there. So let's just take a look at your eyes then, okay? So I want you to just look right in my nose. Perfect, good. And I'm just going to turn my light on. Okay. Just looking at your pupils, good. Just looking at the pupils, good. Just keep looking at my nose, good. Perfect. Good. Alright. Keep your eyes here. And then as the light comes into your vision, just give me a little raise, okay? Good. 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 Perfect. Alright. And now just follow the light. Just your vision. Good. Just with your eyes. Keep your head straight. Good. Just follow it. Perfect. Good. Alright. I have a little eye chart here, okay? I just want you to read back a few of the lines for me, okay? Let's start here, okay? Can you read this one? Okay, good. How about that one? Okay. And the next one. Good, okay, good. Alright, so now I'll have you just cover one eye. Just with your hand like that, okay? Good. Same thing. Good, 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 good. And this one. Okay, that's alright. Now please go ahead and cover the other eye, okay? This one. Good, 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 good. And that one. Not that one either, okay. Okay, perfect. Alright. Next thing I'm going to do is I'm just going to ask you to smell a couple of things. Just to test your nose. Let's see. Alright, take a nice inhale of this. Can you tell me what that is? It's a very common scent. Lavender, good, okay. This one. You ready? Good. Just take a nice inhale. Good. What is that scent? Cinnamon. Okay. And this one. Nice deep inhale. Good. What are you smelling this one? Vanilla. Perfect. Everything is looking very good. Alright. I'm now going to just do some reflexes on your legs. Okay, just be a little hammer on the legs. So just let them loose. Perfect. 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 And perfect. Good. Okay. Next thing I'm going to do is I'm just going to touch different points on your face, and I want you to tell me whether I'm touching you with the soft side or the hard side, okay? Good. So for this part, close your eyes, good. Alright. What do you feel on this one? The hard side, good. Alright, keep your eyes closed. And what do you feel on this side? still the heart. Good. And what do you feel on this one? The soft, yes. And one last time. What do you feel on this one? The soft, good, perfect, okay? What I'm going to ask you to do is just kind of puff your cheeks out a little bit, okay? And then I want you to just clench your jaw. Good, perfect. I'm just going to push down on your shoulders. Don't let me push them up, down, okay? Just kind of resist. Perfect, okay. And then now for your face, I'm going to turn one side. Don't let me turn you, okay? Don't let me turn the other way. Good, okay. Can you go ahead and lift your face and drop it? Perfect. And then side to side on your own. Good. Very, very good. Okay. I think everything is looking very good, okay? I don't have any recommendations, as far as your incident goes, okay? Let's just go ahead and finish the rest of our exam and you'll be free to go, okay? Alright, so I'm just going to press on the belly. Okay, just press. If any part is tender, just let me know, okay? Good. Perfect, good. Okay, everything sounds good there. I'm also just going to take a quick listen to your tummy as well. Just make sure we're hearing those sounds in there. Okay, there's nothing you need to do. You can just lay normally. Good, 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 good. Okay, sounds are very good. Perfect. Alright. Alright. Do you have any questions for me or any other concerns that you want to bring up? Okay. Nope. None at all. Okay. So you are due for some lab work. So I think what I'll do is I'll put in some general labs. You're due for your metabolic panel and your complete blood count. And then we'll just throw a TSH in there as well, okay? Sure. So if you want to head over to the lab after we're done here, we'll just draw your blood and get that sent off and just make sure your picture's looking very good, okay? Everything from our end here is looking well. If you have any concerns whatsoever, don't hesitate to call, okay? Yeah, you should never put off any major health concerns. Yeah? See your doctor right away. Alright. Well, you have a wonderful night. It was a pleasure to see you again. And we will see you next time. Good night. Morika ASMR. Good evening. Welcome. Yes, I was called by our doctor. I'm Dr. Morika. Just gonna do a few tests on you here today, okay? Yeah, that's okay. There were just a few things that they were a little concerned about. So we're just gonna take a peek a little further and get you all taken care of, okay? Good. May I have your first and last name? Alright, and your birthday. Okay. Perfect. Alright. Thank you very much. So during this exam, I'm just going to ask you to do a few things and follow some instructions that I give you. None of what we do here today will be difficult. Or it shouldn't be anyway, so don't hesitate to tell me to stop anything, or if you find something too difficult, please tell me, okay? Good. Alright. Just gonna grab some gloves. Alright, so first thing I'm going to do is just take a quick look at your eyes, okay? Won't be difficult. I'm going to look into each eye. I'm going to ask you to look a few different directions, and I'll have kind of a bright light, okay? If the light is too bright for you at any point, just let me know, okay? Good. Alright, here we go. Alright, so I just want you to stare straight forward. Do not look at me, just straight forward, okay? And then I'm just going to go, okay. And then again, just checking the pupils. Perfect. And again on the other side. Okay. And one more time. Okay, perfect. Alright, and then I'm going to come back on the other side. Okay, good. And one more time on this side. Good. And again. Good. Alright, and one more time over here. Good. Alright. Good. So I don't see anything that is too alarming, so that's good. I'm just going to ask you to follow my light, okay? So do not move your head, keep it level as is. And then I would just like you to move your eyes, okay? You can move your eyes anywhere that I move the light, and just follow them the best that you can, okay? Alright, are you ready? Okay, here we go. Okay, and follow the light. Okay. Good. Very good. It's not a bright light. Should be very gentle on the eyes. Good. Very good. Alright. And then a little faster. A little faster, adjust your eyes, and then straight across, straight across, straight across. Good. And now I want you to tell me when the light enters your peripheral vision, okay? Good. Alright, good. Okay. Okay. Okay, good. Just going to make it a little brighter. a little easier to see. And we're going to repeat the test, okay? So let me know when it comes into your peripheral vision. Okay, good. 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 Alright. And then again, follow the light as it goes around your field of vision. Okay, do not move your head, just your eyes. Good. You're doing very well. Perfect. And again, across, across, and then up and down, up. Good. Okay. I think everything's alright there. Alright, so I just want you to look at me. I want you to raise your eyebrows, okay? Just raise them up. Like that. Good, okay. And then I want you to stick your tongue out at me and just move it from side to side, okay? One side, the other side. Good, okay. Now I just want you to puff your cheeks out for me, okay? Like that. Okay. Just puff them out. Perfect. Okay. And then I just want you to clench your teeth like this. Okay. Perfect. Okay. And one more time. Clench your teeth for me. Okay. And then puff your cheeks out. Good. Okay. I'm going to press down on your shoulders. Do not let me press down, okay? Resist. Okay, good. Okay. Now I would like you to turn your head from side to side, okay? Side to side. Side to side. Okay? Your turn. Side to side. Good. Perfect. You're doing very well. Okay, good. Alright, so next I'm just going to have you smell a few things for me, okay? They should be very easy things for you to identify. So we'll just get started, okay? A couple of little small jars here. And then, what do you smell there? Okay, one more time. Just under the nose. Good. Okay. And what were you smelling? Lavender, yes, good job. Alright, and another. I think this is a fairly recognizable scent. Alright. And what are you smelling with this one? What do you think this one is? One more time. Okay. Good. Okay. Cinnamon. Good. This one was cinnamon. Alright, let's do another. Alright, this time I would like you to just occlude one side, okay? Good. Alright, make sure it's very firm. We only want to be smelling with the one side, okay? Good. Okay. Yes, this one is very strong. Some people don't like this one so much. Good, okay. Tea tree oil, yes. That one is strong. Alright, now go ahead and cover the other side, okay? Go ahead. Good. Okay. Make sure it's very firmly on there. Alright. Take a good smell of this one. Good. What do you think? No. Try again. Peppermint, yes. Okay, good. Alright, that was good. Those are simple ones. Next I think we'll just take a good look at your ears. Have you been having any trouble with your hearing, or a little trouble, okay? Anything that makes it better or worse? And when did this start? It started when you fell. Okay, that's alright. Little ringing. Okay. Okay. I'm just going to lean in a little close to you, and I'm going to take a look into each ear, okay? We're just going to assess inside and look at the condition of the ear canal and then the eardrum itself, okay? Good. Okay, let's see. Yes, okay, I'm just going to pull a little bit on the earlobe just to get us a little bit better in there, okay? Good. Okay, I think everything is looking very good, okay? Alright. Let's take a good look at the other side, okay? Good. Alright. This side looks a little red. Alright. Okay, so this side does actually look a little bit red on the inside. You might have a little infection in there, which could be affecting things. I think we'll still proceed with the test, but we'll give you some drops before we leave, okay? Good. Alright, so first thing, I'm going to whisper a few things into your ears. I would like you to just repeat them back to me, okay? Good. They will be simple. Do the best that you can. If you didn't get one, that'll be alright. Just let me know. Okay. Strawberry. Okay. Strawberry. What do you think about that one? Strawberry. Good. Very good. Okay. Scientific. That one's a little harder, yeah. Still should be fairly easy. Scientific. Yes, okay, good. One more. Coconut. How about that one? Coconut. Okay. Crinkle. What do you think of that one? Not able to get that one. Okay. Definitely seems to be something going on with this side. I'm going to maybe play a few more sounds in your ears. I just want you to tell me if you can recognize them, okay? So why don't you go ahead and close your eyes for this part. And I'll just kind of make the sound in one of the ears. And you just tell me if you think you know what it is, okay? do you think about that one? Cloth. Yes, good job. You ready? How about that one? Tapping, yes, good job. Was any of those sounds harder to hear on one side? This side, okay. That would make sense. Alright, keep those eyes closed, okay? Good. How about that? A spray bottle, yes, good job. Alright, one more here. What do you think that one was? A little harder, huh? Let me do it one more time. Some sort of liquid, yes. They are actually the drops that I'm going to put into your ears, okay? Do that a little bit later. Just gonna do a tuning fork as well. Just tell me if you can hear it on both sides, okay? We'll do this one very briefly. I know some people don't enjoy the tuning fork. How about that? Good. Let's do it one more time. Alright. You were able to hear it on both sides. Good, 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 good. Okay, I'm just going to do a little bit of cleaning out on this side, and I think we'll put a few drops in there while we continue with the rest of the test. Okay, good. Alright, I'll grab my light here again. There we go. Alright, you ready? Definitely a little red in there, okay. You do have a very large amount of buildup as well. Is that hurting at all? A little tender? Okay. I'll try to be gentle. If you need me to stop, just let me know. Yeah. Alright, so I do have some drops to give you. You're going to be able to take this bottle home with you, and I think I'd like you to do maybe 5 drops 2 times a day, okay? Morning and night. just give them a good shake to mix them up, okay? Okay, you ready? And then you can just hold this up to your ear for a moment. Good. Kind of tip it in a little bit, okay? Just tip your ear to the other side so that none of the drops come out. Okay, good. And just a few moments is okay. Yeah, it's gonna tickle a little bit. Okay, good. Alright, I'm gonna do just a little bit of counting. And I want you to repeat them back to me, okay? Good. How's the one ear feeling? A little better. Good, okay. 1, 2, 3. Good. 1, 2, 3. 12, 9, 6. 12, 9, and 6. Good. 2, 5, 12. 2, 5, and 12. Perfect. 25, 15, 100. 25, 15, and 100. Good. 72, 3, 10. 72, 3, and 10. Good. Perfect. Alright, I'm just going to have one more test. I'm going to just spray kind of some special liquid onto some just simple cotton buds. And I'm just going to touch it to your tongue and just see if you can taste them, okay? Okay. Okay, you ready? Okay, and what do you think that one was? Chocolate. That one was chocolate. Grab another. And let's do this one here. And then we'll just put it right on the tongue. Alright, and what is that one? Cinnamon. Good, good, good. Okay. And then another. And we'll just nut on the tongue. And now how about that one? Vanilla. Yes, good, good, good. Okay. And let's try something a little more. That one there. Good. Alright. And what about that one? Okay. A little harder. Okay. That one was garlic. Yeah. A little bit tougher. That one's a new one. Alright. So I think you've done really well, okay? I would maybe recommend seeing the eye doctor. That ear should clear up, but if the drops are not helping, I'd probably come back and, see your primary care provider. Yeah, but no, I definitely feel like those should clear up on you, so I don't think that there's anything concerning here. The ER doc just kind of brought me in just to make sure, so I'm just gonna tell them that I think everything's alright and you're okay to go home and just monitor, okay? Yeah, you did have a pretty big fall. Yeah, and anytime you're dealing with that kind of trauma, sure, yeah, okay, but no problem. Everything is looking really well. I think the ear is just something that was just there. So, in some ways, it's good that we caught it. Yeah. Well, you have a wonderful night, and I'm glad to give you good news. I hope the ear feels better soon, okay? Good. Good night. Morika ASMR. Good evening. Welcome. Welcome to the doctor and the late clinic. So, what brings you to the doctor today? It's been overdue for a checkup, okay. Well, we can provide that. Thank you for coming to the late clinic. We've had a lot of interest and it's been quite busy, so. Alright, let me see here. Let me bring up a file. Okay, first and last name. Okay, and birthday. Okay. Let's see here. So, alright, it has been quite a while since you've been in. What's been going on? Tell me about how you've been, how's your health been, just give me the general kind of overview. You think you've been fairly healthy, okay? How about any family changes? Okay, Yeah, any sort of new chronic illnesses, cancers, things like that? Okay. Not that you're aware of. Good. That's a relief. Okay. How about personal hospitalizations, illnesses, anything, any recent surgeries? Couple of bouts in the ER. Okay. Nothing serious, okay. Let me just take a peek here and check out what those visits were for, okay? Okay, so it does look like a couple of flus and sore throats. You were positive for strep, so not too long ago it looks like. How are you doing now? Throat's feeling all better, okay. You completed your antibiotics? Good. Okay. Perfect. Alright, so nothing terribly significant. No surgeries, correct? Okay, good. Alright, how about any family changes personally? Married, children, anything like that? Okay. Okay. Oops, hold on. Let me get to the right screen. Okay. Alright, so really nothing terribly new. How about you just now? Mental health doing okay? Okay. Alright. Well, if there's any changes, I would be more than happy to send a referral. Okay? Sure. Seem like you're doing okay though. Perfect. Okay. Alright, and then how about any health changes for you? Any new moles, any sort of pain or, issues that you do not feel are normal for you? Okay. Sure. Okay. Well, I can definitely take a look at them here. You have how many moles? 3. Okay. Are any of them new? Just older ones, okay. And have there been any changes? One of them, okay. That's fine. And then you said your ears are feeling a little clogged, okay. How's your hearing been? You You feel like that's getting worse or staying about the same? Okay. So you feel like certain pitches are a little hard. Okay. Alright, how about your vision? Yep, as we get older, there's usually some changes. Yeah. Doing okay there. Okay, well, I think we'll set about doing just a normal physical exam, and then we'll see what we can find. Okay. Perfect. During the exam, I'll be getting a little close to you. There will be a little bit of touching. Is that okay? Okay, good. Okay. Let's put that over there. Alright. Just grab some hand sanitizer here. Clean my hands, make sure everything is good, okay? Okay, and I'll grab a fresh pair of gloves. Okay, we have okay. So first thing I think we're going to do is just take a small set of vitals, okay? Listen to your heart, your lungs, blood pressure, pulse, temperature, okay? Alright, let's see here. Okay, I'm just coming a little bit closer to you, okay? Good. Alright, just take a nice deep breath for me, okay? Breathe in through the nose and out through the mouth. Good. And again, breathe deeply all the way into the lungs. And exhale. Good. Perfect. Alright, other side here. Okay, take a deep breath for me into the mouth and out of the mouth. Good. And again, big breath into the mouth and out of the mouth. Good. Make sure you're exhaling completely, okay? Completely. And one more time here, okay, on this side. Big breath. Big breath. Okay. And I'm just gonna reach behind you here. And we're gonna do the back. Good. Good. Okay. And the other side. Good. Perfect. Alright, great job. Heart and lungs sound great, okay? Okay, I'm gonna just touch right on the inside of the wrist. Is that alright? Okay, good. Okay, just gonna take a peek at my watch here. Good. Doing well. Just relax. Make sure your legs are not crossed. Okay, good. Alright, and also I did get your respirations as well. Just get those done real quick. Okay. Perfect there. just gonna grab a quick temperature. Okay, you ready? Just stare straight forward, okay? And all the way across, good, and back. Oh, hold on a sec. Okay, let's try that one more time, okay? Here we go. And across and back, good, perfect. Textbook. You're making my job very easy today. Okay. Alright, let's take a look at your eyes, okay? I have an otoscope here. I'm just going to use the tip of it with the light to look into your eyes, okay? I'll just have you follow some very simple instructions and it'll be very easy, okay? Alright, let me grab a fresh tip. Okay, here we go. There's the light right there, okay? So I just want you to follow it. Okay. Keep your eyes right here on my nose. Good. Perfect. Right across. Breathe normally and naturally. Okay. Just keep looking right at my nose. Perfect. Perfect. Good. Great. Great. And now just move your eyes with the light. Move your eyes with the light. Good. Perfect. And maybe the other side, okay? Just keep watching it. Moving only your eyes. Moving only your eyes. Okay, good. Excellent. Now again, just stare right into the center, okay? Good. Just gonna bring it into the side. Check your pupil reaction, okay? Right into the side. Good. Okay, and again. Good. And again. Good. And one more time for good measure, okay? Perfect. Perfect. And perfect. Alright. I'm just gonna have you stare straight forward, and I want you to tell me when the light comes into your peripheral vision, okay? Good. Here we go. Just tell me when you can see it. Good. Okay. And again. Good. Okay. And again. Good. Perfect. Good. No pressure here, okay? And when do you see it? Good. Very good. Okay. So I have a little light chart here, okay? Alright, so we're just gonna start kind of at the top, work our way down, okay? What's this one? An E, perfect. This one. An L, perfect. A T. An F. That one. A P, perfect. An H, okay. How about this one? Nothing, huh? Okay. An L, good job. Nothing on that one, okay. That was a C. And nothing, okay. That's okay. Nothing to worry about. What color is this? Red, good. And this side, green, perfect. Okay. When was the last time that you had your eyes checked? It's been a little while, okay? I know sometimes life can really catch up with you, and suddenly it's been a long time since you've had some of those things done. So, you've done a great job coming to the doctor and, being here, but also I would recommend making a visit to the eye doctor. And, how about the dentist? You've been there recently? A very long time. Okay, well, definitely do that. Some of the cleaning they do is a little difficult to do at home, okay? You want to make sure all that buildup's gone and your teeth are healthy. That can really affect your overall health, okay? Alright, so, nothing too concerning about your eyes today. I'm going to let you talk to the eye doctor, but, maybe a pair of reading glasses might not hurt for you, okay? Okay, good. Okay, just a couple of simple things and then we'll take a peek at your ears, okay? Okay. So I'm gonna just push down on your shoulders. Don't let me. Good, perfect. I want you to just puff out the cheeks for me. Okay, puff out the cheek. Good, okay. Raise your eyebrows. Perfect, okay. And I just kind of want you to make like a scrunchy face, okay? Perfect, alright. And then hold your hands out here. I'm going to try to lift them from underneath, and I want you to push against me, okay? Push. Good. Okay, perfect. Alright. Got a little reflex hammer here. You are sitting on the table and your legs are dangling, so I'm just gonna catch that reflex real quick, okay? Good. Okay. Perfect. Good. Perfect. Get your elbow here. Perfect. Okay, just gonna get your pulses here, okay? That's better. Good. Okay. Alright, I'm gonna grab another fresh tip here, okay? And we're gonna take a peek at your ears. So, let me just turn my light on, okay? Good. Oh dear, okay, we've got quite a bit of buildup in here. Okay, yeah, occluding the eardrum. I'm just gonna tug a little bit, just on the earlobe, kind of bring it back a little bit. Just helps me see a little bit into the ear canal, okay? Good. If there's at all any pain, just let me know. Okay, just gonna pull that back just a little bit. Okay, good. Okay, gonna need some cleaning on that side. Peek there. On this side as well. Okay. Okay, so your ears are definitely a little red, a little inflamed inside, and it might be due to a lot of earwax buildup. This side is completely occluding the eardrum, so I imagine you're maybe having a little trouble hearing, maybe a little ringing in the ears. And then this side, not as bad, but still gonna use a cleaning. Is that okay if we take care of that? Okay, it won't take long. Let me grab a couple things here. Okay. So what I'm going to do is just put some drops in your ear, okay? A couple in each side. We're gonna let that sit for just a second, and then we'll just scrape a little bit away, okay? Till you're nice and clean. And then we're gonna irrigate, okay? Okay, go ahead and tilt your ear. Perfect. And now the other side. Okay. We'll let those kind of sit for a little bit. Let me take a peek at those moles while those are sitting. Okay. Alright, where are they? The one on the face here, okay. Just grab my little measuring tape here, okay. Okay, really not terribly concerning. Okay, good. It's not very big. Okay. No, I think this pattern is okay. How long have you had this one? Your whole life, okay. Usually the moles that you start out with or have from a very young age are not quite as concerning, especially if you're not noticing any changes, okay? That being said, do make sure you're vigilant to keep an eye on it, but I don't think there's any trouble with that one, okay? And then you have one on your arm, okay? And how long have you had this one? This one's new, okay. When you say new, what do you mean? Within the last year, okay. Since you first noticed its appearance, has it changed at all? No, okay. It does look slightly different than your other moles though, okay? And I am a big proponent of better safe than sorry, okay? So what I'm gonna do is I'm going to give you a referral to the dermatologist, okay? And I want you to take it seriously. Please go in and just have them take a look at it, okay? If they want to remove it, they might have a little biopsy and just get it checked out, okay? To make sure none of those cells are something you should be worried about. From my eye, I think it's fine, but I do think that we should get it checked out, okay? I'm always very cautious when you have something that's new that pops up, so, correct. Okay, let's take a look at those ears, okay? I have a couple of ear cleaning tools that I will use to clean the ear, okay? So, this shouldn't hurt, but I will be putting a large amount of saline through your ear, and there will be a little bit of scraping, okay? Okay, here we go. is all cleaned out over here. Okay, good. Just take one quick peek. Perfect. Alright, let's do the other side. This one wasn't as bad, okay? So we're gonna do it. Okay. Alright, those are looking much better, but I'm gonna recommend that maybe you go to an ear cleaner maybe once a year. And then also try not to use ear like Q-tips inside the ear canal. Sometimes those can push the earwax just further into the ear and can create some impactation right against the eardrum, can lead to some symptoms. Sure, okay. Alright. Is there anything else that I can help you with today? Okay. I would say overall you're doing very well. Okay, nothing terribly concerning today. Just want to write your prescription, I think. This is going to be for some eardrops. Okay. Those eardrops will help with any inflammation, okay? And then I'm also, just sit tight real quick. Just gonna send a referral out, okay? This will be to dermatology. Okay. Perfect. And then also, would you be receptive to doing some lab work? It's been so long since you've been in that it's good to have a new baseline for you. Okay, good. I'm gonna put in for a lab draw. You can head right out to the lab station. After this, they do take walk-ins. Shouldn't take more than about 15-20 minutes. Just put in some metabolic panel, complete blood count, and probably a TSH, I think. Okay, perfect. Okay. Alright. Well, if there's nothing else, I'll let you get on with your evening, and we'll see you next time, okay? Good night. Morika ASMR. Good evening. Welcome. What brings you in today? Besides the obvious. Okay. I do have you pulled up here. If I can just verify your first and last name. Okay. And your birthday. Perfect. Alright. I'm Dr. Morika, and I'm here to just take a look at your face and head. Yeah. So you had a little bit of a fall, which it's okay. Have you had any symptoms besides the wound on the face and the head? Okay, a little dizzy. Did you ever lose consciousness or, edges of your vision blurry or black? Okay. Everybody involved says that you are conscious and awake the whole time, so that checks checks out with our side. So that's good. Is there any other concerns with how you're feeling? Vision troubles? Hearing issues? Okay. Are you still feeling dizzy? A little bit, okay. I think we'll just do a standard physical here, and then we'll treat the wounds as well, okay? I'm going to take care of those wounds first, and then we'll just check you out afterwards, okay? If you are, okay after that, we'll send you home. If not, we might keep you for observation for a little while, okay? Good. Alright, I'm just going to clean my hands with a little alcohol. I'll grab a fresh pair of gloves. Alright, so let me just take a closer look. Grab a light here, okay? Don't mind me. Okay, just taking a little bit closer look at this, okay? Okay, looks like a fairly simple cut. And you said that you slipped and fell? Okay. No problem, okay. Let's check out this side, okay. And then I'm gonna get a little closer to you. I think I'm just going to take a peek at the scalp as well. Just going to part the hair. Just to get a really good look at the scalp, okay? I really don't see very much on the scalp, so that's good. A little redness, but there's no wound. Look through the entire scalp, okay? Do you know which direction that you fell? Okay. Alright, so sort of on the side. We're just gonna look through always. Did you fall on anything, or was it just straight to the ground? Okay. Alright. Everything looks pretty good on the scalp, but there is the cut here, so I am going to go ahead and get that cleaned up and bandaged for you, okay? Alright, once we're done, we'll just do some simple tests, and then we'll get you out of here, okay? Good. Okay. Let me just grab some clean swabs. I don't think you'll need any stitches, so that's good. It's really just the dizziness that I'm a little concerned about, okay? Let me just grab some cleaner, and we'll just go ahead and get this very cleaned up, okay? There we are, just a little to the side. There we are, just a little there. get you all cleaned up. Good. Very, very good. Okay, I'm gonna grab one more clean one here. Just a little more. It's a little bit of dirt from the ground, so we just want to clear that away. Good. Very good. Do you have a headache or anything like that? Okay. No headache, okay. Gently, just gently very, very good. Just gonna pat it gently. Okay. Okay. Just gonna put a clean bandage over the top. There. That should do well. Looks like the bleeding had pretty well stopped. It is a pretty good gash, but I do not think that you need stitches, okay? If for some reason it starts bleeding again and it doesn't stop, I want you to come back in. But I think you'll be okay for now, okay? Good. Alright, so let's just do some simple tests just to kind of make sure you're doing okay. Regardless of what happens here, I do want you to monitor yourself for at least, a few days, just to make sure that you're not getting any headaches that won't go away, that you're not feeling too dizzy, you don't have any, sudden urges to throw up or anything like that, okay? Yeah. So if anything seems odd to you, please come back in, but we'll just see what we come up with here, okay? Good. I am going to just take a quick listen to your heart, okay? Alright. Go ahead and breathe in for me, okay? Deep breath in through the nose and out through the mouth. Good. Another deep breath in through the nose and out through the mouth. Good. One last one. Deep breath in through the nose and out through the mouth. Good. Let's go to the other side. Okay, deep breath in through the nose and out through the mouth. Good. Deep breath in through the nose and out through the mouth. Good. And last one. Deep breath in through the nose and out through the mouth. Good. Your heart sounds pretty good. The machine's telling me your blood pressure and your heart rate are great as well. Okay. Just get a little temperature on me as well. Okay, just gonna swipe this across your forehead. Okay, good. Normal. Perfect. Okay. Alright, I am going to use the otoscope just to take a look at your eyes and your ears, okay? Just put a nice fresh tip on, just for you. So here we go. I want you to take your eyes and look right here, right where the light is, okay? Good. And I want you to follow that with only your eyes. Do not move your head, okay? Just your eyes. Here we go. There we go. Just watch it as it goes across your field of vision. Good. Keep it up. You're doing wonderfully. Good job. Good job. Perfect. Okay. I'm gonna just bring it kind of far away from your field of vision. When you can see it in your field of vision, just go ahead and give me a little hand raise, okay? Good. 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 Okay. Next thing I'm going to do is just take a quick peek into your ears, okay? Okay, just taking a look at the ears. Everything looks clean. Eardrum intact and not red. Okay, just the other side here, okay? Alright, everything looks good. Eardrum is intact. Clear. Good. Okay, everything looks really good in there, okay? Alright, I'm going to ask you to do a few things, okay? I have some cotton swabs and I have a few scents I'm going to put on the cotton swabs. Just going to kind of waft them under your nose. I want you to just tell me what they are, okay? Let's see, let's pick this one here. Okay, first one, here it is. Slowly under the nose. Good. What's that scent? Okay. Vanilla. Great. Okay. And these should be pretty familiar too. Alright, here's the next one. If you don't get it right away, that's okay. Sometimes scents that I think are easy might not be easy for everyone. Okay, here's another. What do you think of this one? Peppermint, great. Okay, and we'll do one more. Okay, take an inhale of that. Good. Chocolate. Good job. Okay, you've done really well. sides of your face, okay? Just checking the muscles, okay? I'm going to have you puff out your cheeks for me, okay? Good. Alright, I want you to close your jaw, okay? Just like clench your teeth a little bit. And then I'm going to put my hands under your chin. I want you to try to open it, okay? Okay, good, good. And then I'm going to try to open your jaw. And I want you to resist, okay? Ready? Okay, good, good, okay. And same thing with your eyelids, okay? Close them. And I'm going to try to open them. There we go, okay? And the other side, okay? And good. And then open them, and I'm going to try to close. Good. Very good. Okay. Okay. I'm going to put my hand on the side of your face. I want you to just turn into it, okay? Turn into it. Good. And then here again, turn into it. Try to move me. And good. Good. Alright, I want you to tilt your head up and then tilt it down. Perfect. Go ahead and raise your shoulders. Okay, and again, raise the shoulders. Perfect, okay. Alright, go ahead and push against my hands. Perfect. And then I'm going to grab your feet. Go ahead and push against them. Good, 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 good. And then I'm going to try to lift them up. Here we go. And good. And then I'm just going to check the pulses in your feet. Okay. And those are good, good. Okay. Okay, here we go. I'm just gonna have this swab here. One side is soft, one side is hard, okay? Tell me if it's hard or soft. Soft, okay. Hard. Soft. Hard. Soft, hard, soft, and hard. Okay, good. I have a little reflex hammer here. I'm just going to tap your knees a little bit, okay? Ready? Good. And your elbows. Okay, good. Eye chart here. We're just going to check you out a little bit here. Do you typically wear glasses or anything? Any correction to the eyes? Okay, good. This one? Mm-hmm. 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 No, okay, that's okay. Other side. Mm-hmm. 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 No, that's okay. Alright. Red or green? Red or green? Okay, good, good. There we go. Alright, I have two little sticks here. They have some animals on there. I'm just gonna have you tell me this top one. Just grab something a little more benign. Top one, car, elephant, bear, sailboat, cat, cup, horse, duck, and a star. Okay, can you recall the first two? Okay, that's okay. Let's try it again, okay? Car, elephant, bear, boat, cat, cup, horse, duck, and star. Can you recall the third one? Bear, good, good, okay. the other one, okay? Horse, duck, dragon, butterfly, fox. Can you tell me the second one? Duck, good. Horse, duck, dragon, butterfly, and fox. Good. Can you tell me the first one? Horse, wonderful. Okay. Alright, everything's looking pretty good, okay? I don't have any further concerns for you. Just make sure you're changing your dressing at least once a day here, okay? I suspect you can probably take it off in a day or two, just completely. Okay? If you are having troubles with any of those things I mentioned earlier, still feeling dizzy after several days, having trouble getting up, headaches that you're not sure what they're from, headaches that won't go away, changes in vision, any concerns whatsoever, do come in to get it checked out, okay? But as of now, I think you're alright. Good. Alright, I'll have the nurse come in and bring you some discharge papers. Is there any questions for me? Okay. Nothing at this time, okay? If you think of anything at all, feel free to call, okay? Good. Well, you have a wonderful night. It was great